right? So I think I strained my back while lifting. Any tips? Okay. So first things first, most back pain is musculoskeletal in origin. About 70 to 80% of all reported low back pain cases are. And these include things like strains, disc herniations, slip joints, chronic degenerative joint disease. And it may or may not involve radiculopathy, which is kind of like where you feel pain radiating down your leg. The good thing, though, is if it's acute back pain, there's a very good chance that it's going to improve within a week or even like 1 or 2 weeks, right? And so that's a good thing. So remember, if you have that situation, the likelihood is, provided you do the following exercises and you take it easy, you don't overstretch your back in a certain way, how long the time period is usually limited to no longer than 1-2 weeks. Okay, there are some warning signs. If you guys had a recent history, and so this is actually a mnemonic I used when I was studying for a medical board, tuna fish. And these are typically symptoms that are concerning for physicians if you have back pain. So if there's obviously a significant trauma to the spine, then that would be very concerning and probably would merit going to the urgent care center. If you have unexplained weight loss in addition to back pain, so this is, in relation to the fact that it might be cancer in the spine. Of course, with acute back pain, that's not really a concern. If you have neurologic findings, so you might have numbness radiating down your leg, but if it's extreme, if it's significant numbness going all the way down to your foot, and that's kind of progressive, or if you're having trouble, holding in your urine or defecating, you may have something that we know we consider cauda equina syndrome, where a portion of the spinal cord is being compressed and you have central disc compression. And we'll talk about that in a little bit when we see anatomy against the spinal cord. And this is an ominous issue. So again, really, if you have issues with bowel or bladder incontinence, difficulty controlling those, or just progressive increase in numbness moving down your extremities, that would be something that'd be scary. So this whole age dynamic, this I think is more of a demographic deal. If you're greater than 55 years or greater than 65 years, not every person in this age group has these, but they're more likely to have osteoporosis and suffer more severe fractures. That is a concern. Fever, why? Because it could be an infectious process. If you don't have that, then not such a big deal. Immunocompromised, again, also potentially either tumor or infectious process. And then if you are using steroids make it more likely for you to suffer a fracture if you have long-term corticosteroid use in your vertebra. And then finally, HIV, tuberculosis, or cancer, which again leads to the fact that there might be other pathology going in the spine. So if you don't have these things, it's likely more musculoskeletal. Okay, so just a quick review of back anatomy. So your back is kind of bent in this sort of position, and it's not entirely straight, right? You have these curves here. You have lordosis, where it's kind of an inward curve of your cervical spine. You have kyphosis, where it's more of an outward curve of your thoracic spine. And you have lordosis, which is more of an inward curve of your lumbar spine. And so most of us, obviously low back pain involves mostly the lumbar spine, right? And it's usually because we're not maintaining appropriate lordosis in our back, right? And that could be secondary to poor posture, which is the main cause a lot of us have. And it doesn't necessarily need to be, during sitting or standing. It could be during lifting. You probably have heard people say, don't round out your back when you're doing deadlifts, or, when you're bending things up, pick up things with your knees versus your back. And that's because when you bend over and you flatten and you round out your back, you flatten out this lordosis in your spine. And we'll find that can be bad because it stretches certain ligaments. So it can overstretch muscles, right? So the main muscles in your back are that flex your spine are the erector spinae, the multifidus, and the semispinalis thoracis. These could be overstretched or strained, or could strain or tear some of the ligaments. Here are a couple of them. The main ones that we'd be concerned about are the supraspinous ligament, the interspinous ligament, and then the transverse ligaments, which are, you can't see these, but they're ligaments across the transverse processes, right? And these can get stretched too. So, and then finally, the intervertebral disc. So like your spine has these vertebral bodies, right? And then in between the bodies, they're cushioned by this cartilage, which is kind of like a gel-like substance, and it squishes, right? And it allows kind of movement along the body, so they don't, obviously crush against each other. But if you have continuous extension or flexion over time, the material within these discs can become deformed, right? And it takes months or sometimes even years, but as anyone who's observed a teenager, sometimes people, they'll be in a state of slouching for a long period of time, right? And that over time can cause derangement of that disc, which can impinge on these spinal roots, which are roots of the spinal cord. And that's what's causing some of the nerve pain you might feel that's coming down your leg, right? Okay, so how can we improve this? Well, to prevent it, obviously try to practice good posture. And the main thing for low back pain is maintaining lordosis in your lower back. So this individual here has good posture and this individual has poor posture. And you can kind of see how some of us adopt this position when we're sitting down too, right? You can be sitting and kind of curved over or hunched over. A lot of us do that at our desk, right? And certainly like when you're tired, or even like when you're resting, like on, perhaps like you're sitting on the ground and you're kind of resting with your arms across your knees, right? That is actually putting a lot of strain on your lower back. So it's important to maintain that lordosis. Okay, so what if you didn't do that? And what if you now have low back pain and you recognize you don't have tuna fish, right? What do you do now? Well, so there's this really prominent physical therapist. He's from New Zealand, Robin Mackenzie, and he came up with something called the Mackenzie Method, which is surprisingly effective in helping people improve low back pain acutely. And what is it? Well, it's a simple set of exercises. So again, number one, make sure you don't have tuna fish and make sure you're not completely immobilized. But the first step is to lie flat on the ground, right? And then you want to turn your head to the left. Okay, that's easy enough. Then you want to kind of raise yourself slowly on your elbows, almost like, like Sphinx position, right? And then you kind of want to raise yourself even more upwards so that your arms are straight. And you want to make sure there's a bit of a slack in your lower back, right? And so you go from exercise 1, 2, and then 3. And then once you get to 3, you want to do about 10 repetitions of that. And that movement, that slack that you're creating in your lower back seems to really ease inflammation and seems to really improve low back pain. It's been actually studied as a treatment modality for patients suffering from acute low back pain that's musculoskeletal in nature. Okay, so here's a good picture of an individual doing it in practice. See how he's kind of extending out his back and kind of there's a little bit of a slack here in his lower back. That's really important. And so what you would do is if you are unfortunately suffering from low back pain, obviously, make sure that you're able to, most of us, of course, when we get low back pain, it's more so like when we lose our lordosis that we tend to have pains, like when we hunch over, right? So whatever you do, maintain your lordosis, do exercise 1 and 2, and then do 10 repetitions of exercise 3. You may need to do it kind of frequently the first couple of days. He recommends every 2 to 4 hours. And then within the next 2 to 3 days, your pain should improve significantly. He also mentions limit sitting if you can. If you have an episode of acute back pain, and if you have to sit against a firm chair and maintain your lordosis. Use good posture. You can use lumbar rolls to kind of push your back forward, and that, of course, will help reduce you from getting out of the lordosis in your lower back. Of course, NSAIDs work pretty well. Naproxen, 200 to 400 milligrams twice daily to 7 to 8 days will certainly make that week a little bit better for you. And you using a roll or lumbar roll while you're sitting could be good, but also using it while you're sleeping is key too, because then you also want to make sure you maintain your lordosis. So that's really good. If you guys are interested more about this, I would suggest getting his book. I'm going to stop the share for a second. This book right here, Treat Your Own Back by Robin Mackenzie, really is an excellent book. And I'll if anyone's interested, I'll leave it in the notes. You can get it off Amazon.com, but it really has a lot of great information, not only for getting out of episodes of acute lower back pain, but also for preventing that from occurring. The key thing to remember, if there's one thing to take away from this, is try to maintain the lordosis in your low back. Have good posture. Your mom was right. It's important. Don't slouch. It's not good. Have good posture, maintain your lordosis in the lower back, and that's likely to greatly reduce the chances of you suffering from it again. Okay, the third question. So this is something I get periodically, and it's usually by people following the carnivore diet. Is animal fat really that bad? Okay, so, some of my patients are on keto, carnivore. They don't care about fats. If it's saturated fats, it's fine. They eat a ton of red meat and pork, and they drink full fat milk, and they feel great, and they swear by it. So my first question is, let me see their lipid panel. Usually they don't have their lipid panel, but outside of that, are there some other issues? Well, okay. One thing to realize is adipose tissue is a great reservoir for toxins. And this has been noted in the literature. For example, this article right here, adipose tissue is a site of toxic accumulation, right? So this individual, Dr. Jackson, in the Journal of Comprehensive Physiology, talked about how persistent organic pollutants, they call them POPs, are found largely in adipose tissue, and they accumulate pretty significantly. And these include things that they're byproducts additionally of plastics. I don't know if you guys remember that talk I did on plastics in the environment, but remember our old friends polybrominated biphenyls and diphenyl esters, these seem to accumulate in the fat, in addition to many other toxicants that are found in the water, air, etc. Okay, and so we know this is true for humans, right? And it's likely true for animals. But then some of you guys are like, well, how are these animals exposed to plastics, right? I mean, it's not like they're, they're not meal prepping, putting stuff in plastic bags. Well, they are exposed to plastics, but in a more insidious formation. So this is an article that came out in The Guardian. So did you know that it's actually completely legal to add plastics to animal feed? It is. So what, what, what some, I guess, enterprising commercial food processors are doing is they are adding this to increase bulk to animal feed. And it's really common in pig farming. And this was actually an article based in Europe, but it occurs very frequently in the US, and it's legal. There is a percentage of plastic that's allowed. Now, in the UK, the limit is 0.15% plastic, but in the US, I think it's actually a bit higher. Okay, so the animals are getting this. They're definitely getting this in their diet. So going back to your question over here, is animal fat really that bad? Well, if you can prove that the animal is completely organic and only eating grass and had a super healthy diet, and maybe you had documentation of the animal not being exposed to any of these deals, okay, maybe. But I don't have that kind of power, and I certainly would not be able to guarantee that if I was an organic farmer. So I would just focus on eating healthy lean meats primarily, and that's one of the reasons. There are other reasons, but that's one of the reasons. But yeah, okay. So hopefully that was. I know that's a little bit different than the typical session we have, but those are some questions that came up, and I thought would be useful to answer. Now let's go into some of the questions here. So